World AIDS Day is a day to celebrate the progress we've made in the fight against HIV/AIDS, but it's also a day to remember the lives of those we've lost to the disease, and to think critically about what we have left to do. The global community has made tremendous progress in the fight against HIV/AIDS. The President's Emergency Plan for AIDS Relief, or PEPFAR, the U.S. agency leading the global AIDS fight, has saved tens of millions of lives through testing, treatment, and care they provide to people living with HIV, as well as those vulnerable to the disease. Today, as PEPFAR does for every World AIDS Day, they release their latest global results. The link is below, and I encourage you to check it out. You can really see the magnitude of what U.S. taxpayers' money has been able to accomplish when PEPFAR works in partnership with national governments to save lives. But women living with HIV are facing a second threat. They're at an increased risk for cervical cancer. Women living with HIV are up to 5 times more likely to develop cervical cancer than their HIV-negative peers. And cervical cancer disproportionately affects women living in low and middle income countries. From the deaths of cervical cancer globally, 85% of those occur in low and middle income countries. To address this disparity, Go Further, a partnership between PEPFAR, the Bush Institute, UNAIDS, and Merck, is working to scale up cervical cancer screening and treatment services for women living with HIV within HIV care and treatment settings. This is a really effective and efficient way to deliver care to the women most at risk. In our first year, Go Further has reached over 500,000 women with screening for cervical cancer. 80% of those women are first-time screeners. Today on World AIDS Day is a day to celebrate what we've accomplished, and also a day to recognize that if we just go one step further, we can save women's lives from cervical cancer while they live full and healthy lives with HIV.